hyperparathyroid problem. It's an issue. A lot of docs miss it because it's different for us boomers than it is for younger people. The numbers are all different. Take a look. Why would we talk about calcium, supplements, and hyperparathyroidism? Because as I said a few minutes ago, yet another place where us boomers have to watch out for our health because quite often our doctor won't. Hey, Seuss, you want to get us started?
Yeah, so this is an organ you don't hear too much talk about, which is the parathyroids. And you don't hear too much about it because they're just so small, and even doctors don't talk too much about it. We leave that to endocrinologists to deal with that. But they are located behind the thyroid, and they have a really important work on regulating calcium and other substances such as phosphorus. And what these glands do is they produce an hormone called parathyroid hormone. They do that based on the orders they get from the hypophysis on the brain. And this hormone, what does is moves calcium from the bones to the blood, makes more calcium available on the bloodstream, and also increases the absorption of calcium from the intestines, and it helps kidneys to hold on to calcium and return it into the bloodstream. So what you see is high levels of parathyroid hormone mean increased blood calcium levels. If you have lower levels of parathyroid hormone, you will see lower levels of calcium. And it's just a balance of how many hormone, how many calcium do you have, and what you need it for. Here on this slide, we see that blood calcium levels are, in patients over 40, it's considered to be above 10.1. That's a red flag, or a yellow flag at least. But people who are younger than that might have more available calcium on the blood. So there are some things that we need to consider when we have high blood levels of calcium, and that's the productions or the creation of kidney stones and other issues related to calcium. And the disease that we're talking about is called primary hyperparathyroidism. Pardon there, because it says hyperthyroidism, it should be hyperparathyroidism. And that happens when you are having increased production of parathyroid hormone. So if you have been able to follow up with me, increased parathyroid hormone means higher levels of calcium on your blood, and that might lead to kidney stones and osteoporosis. And parathyroid hormone is not the only thing that has influence on the calcium metabolism. There are other things that do have a role on calcium metabolism, and that's a vitamin that we have talked about on this channel for a long time, and that's vitamin D. So whenever you find someone who has high levels of calcium in the blood, we need to address and consider that might be something related to function of the parathyroid glands.
We had a patient recently, that's what brought this up, and the patient had a problem. Asked him a little bit about symptoms like cramps, and he said, yes, I am having cramps. So we said, okay, we need to get a parathyroid hormone level, and you need to see an endocrinologist. And sure enough, he had it. He had his surgery just a couple of weeks ago, and he's feeling great. As I think I mentioned earlier, I have a family member as well who had this. It's usually benign. It's rarely anything significant. However, you got to go through that surgery, and that surgery is very close to the thyroid gland, and it requires a little bit of unique skill set.
And I think that's something that happens a lot, and we don't talk too much about it, but when somebody has osteoporosis, the very first thing you will get is, well, you need calcium supplementation. What if your problem is not that you don't have enough calcium? Your problem is that your parathyroid hormone is taking your calcium out of your bones, and that's why you have osteoporosis. So you will find yourself with osteoporosis, low calcium on the bones, but high calcium on your blood. And then you get supplements with calcium, and that increases the amount of calcium on your blood, but that's not helping. It's not solving the problem, and that just puts you on more risk of developing kidney stones. So whenever somebody is identified with osteoporosis, it's a good idea to check calcium levels on the blood and identify what's the cause.
Really good point.
And just like we mentioned here, for people with high calcium levels, refraining from taking more calcium or vitamin D supplements and staying hydrated, that's important, and get a specific evaluation to see if there is a requirement to take those glands out.